vector-borne diseases, especially CHIKV. I want to hear your stories and any questions you may have about CHIKV. So call our lines now at 931-6193, 969-3705, and 1-888-991-23989. In the meantime, let's talk about vector-borne illnesses and why CHIKV is so horrible to us. You know, I mean, the thing is that it hit us, when I say us, in the Caribbean, kind of quickly and came out of nowhere. Until 2013, you know, we really didn't ever see it here.
In fact, now America only knows about it because Lindsay Lohan got it week before last, and they're like, what is this?
I know. You're absolutely right, because I told my anesthesiologist I was working with, I said, you know, we're going to be talking about chikungunya virus. And I expected nobody to say anything. She goes, oh yeah, Lindsay Lohan has it.
Right.
I said, what?
Social media again.
It's huge. But you know what? For you know, to her benefit, despite Lindsay Lohan having a lot of problems in the past, what she's done is increase awareness of something. Listen, in India in 2006, 1.4 million people had it. You know, it's been around since the 50s and it's been described since the 1700s, but very few people, including medical people, know when you say CHIKV, they say you're talking about a chicken. You know, they don't know anything about it.
Oh,
and
wow.
the interesting thing is that the name chikungunya comes from the native language in Tanzania, which means that that which causes to be bent up or stooped, because it causes such disabling arthritis that you can hardly walk.
Absolutely.
And so people think it's from the chicken or who knows what, but the word chikungunya is actually from the native language in Tanzania because the people had so many problems. But do we have a call?
Yes, we do. Let's take this call. Good morning.
Hello.
Hi, I'm going to ask that you turn off your TV. Did you get CHIKV?
Yes, I did.
All right, tell me the question that you have this morning.
Yes, I did.
What's your question?
Stop listening to your TV, please. What's your question?
Are you there?
All right, we're gonna cut that call.
Yes.
I want to know, why does it stay in the system for so long?
Yeah, so here's what happens. So in the beginning, you have kind of a regular viral infection. So you get fever. Fevers are high, you know, about 40 centigrade or 104. And then you feel malaise. But here's where it really makes an impact, that within a few days, people get joint pains, you know, in the hands and also also in the ankles. And that is not just a little bit of arthritis, very painful arthritis, almost disabling. But once that infection is gone, for a lot of people, 7 to 10 days it's gone, but it can linger on because of your body's immune reaction to it. So imagine your body has several armies to fight these like bacteria or virus. When the virus comes, it attacks. But the way it attacks you, that some of the immune complexes, some of the stuff that's around your body to fight it, can also damage your joints.
Wow.
And so in some people, and we don't know why, that some people get nothing, others get these problems. It's to do with immune complexes. There's a disease called rheumatic fever, and you may have heard of it. People will get bacterial infection, and then the bacteria may be gone, but they get these problems with arthritis or heart problems. It's similar. It's your immune reaction to it, and it can last for years. There was an outbreak in France, and up to 60% of people 3 years later still had arthritis problems.
Unreal.
And waking up in the morning had still that symptomatic arthritis. So it's obviously the infection that comes across is important, but what people need to know is it can relapse. The other symptoms, especially the joint discomforts, the arthralgias, can really last for quite some time. Did we get the caller back?
Yeah.
Oh,
Morning.
Hello, morning.
Hey, go ahead.
Yes, I had the CHIKV the first week of December, and it lasted for a week. I was in bed for a week, couldn't walk. And about 4 days ago, I realized that I can't move again. My joints, my elbow, my knees, my ankles, and I'm feeling a pain in the stomach now. Like my heart is racing.
Yeah, so here's the thing, and this is, you have to see your doctor right away, because you're having the problems that we talked about, which is the chronic relapsing arthritis that can happen. The one that concerns me the most is your heart rate beating high. Now, it may be because you're worried about something that's happening, but I would see the doctor because they can also have cardiac side effects with this. Rarely, but it can happen. Mainly, though, the problems that you're talking about with the joints have been seen. You know, taking medicines like Tylenol or paracetamol. Even ibuprofen you can take, just don't take aspirin. Those will help with the symptoms quite a bit. Ibuprofen, you know, in the forms that you can see they have it over the counter all over the world. You can use that to help with the symptoms, and it decreases some of the inflammation. But I want you, when you tell me that your heart is racing, it may be because you're concerned about this, but there can also be other severe problems with it. Can I ask you a question? Do you have any other health problems?
No, I don't.
And how old are you?
I'm 35.
Okay, so very good. I think you're in good shape. I think you'll do well over time. Just for people who are listening and viewing, the folks that have problems with this the most are ones with other diseases like diabetes, or if you have other medical conditions, and older folks, over 65 especially, and very young people. You know, they had outbreaks in France I was talking about before, and neonates were infected, and it can be really, really serious. So again, even though you're 35 and you don't have any medical problems, please see the doctor. Make sure that everything is okay. I think that with the medicines we talked about, again, we call them non-steroidal anti-inflammatory drugs, so it's a big name, but basically medicines like ibuprofen, medicines like Tylenol,
Panadol.
Yeah, and so those things, but try not to use aspirin if you can, okay?
Thanks, Sonia.
Okay then, sir. Thanks for
You're welcome. Thanks for the call.
People have been self-medicating.
Yeah,
I mean,
BCT.
particularly at the time when it was at its highest. People were like, I'm already in pain, to go sit and wait at a health center or a clinic for 2 hours, 3 hours, 4 hours to go see a doctor. I'm just going to go home, take some Panadol, drink some BCT, drink some papaya tea, and call it George. Do you recommend that they take the time to sit in that waiting room and see the doctor?
I do, but I also think that taking the medicines to help you feel better is not a bad thing, but I would get it if you can afford it. Now, I don't know you know, how expensive getting the treatment to prove that you have the disease is for some people, but if you can afford it, I would get the treatment to prove, because it is important. It is important to know that you have the chick V or something else, because remember, some of the mosquitoes that carry chick V also carry dengue,
malaria,
you know, and so anything else. So I think it is worthwhile sitting to the doctor and working with him. But I also think if you're at home, taking some water, making sure you're hydrated, making sure you're taking the paracetamol or Tylenol or ibuprofen is also helpful. I would not go against it. Now, BCT, I think there's a lot of medicinal properties, right? Has not been studied for this, but I don't think it's been shown to be harmful.
Right.
I don't know if it's gonna cure it or may make you feel better, but I think again, getting symptomatic treatment is not gonna hurt you.
All right, we have a next caller.
Yes.
Caller.
Good morning.
Hi, Clive.
Good morning.
I'm just trying to find out, I was just saying, it has been known for a long time about this chick V, and we still don't come up with a cure. Now, there's also a symptom after it's gone where you feel like it's still in your body, and sometimes you feel like, say, one ear feeling a movement in one area, and all of a sudden it goes to another area. Is that normal?
It can be, yes. So a couple of comments you made, very important ones. You know, it's been around for a long time, but there's no cure. You know, unfortunately, this is the sad truth about it. I mean, imagine the areas of the world that's been in. You're talking about East Africa, off the Indian Ocean. You know, a lot of poor villages have had it, and so there's not often the budget or the calling to get a cure. This is just the reality. It's not right, and it's not how it should be. But it's been in Africa, India. It's been all over Southeast Asia. So, you know, it has not hit Europe with the kind of veracity as it's hit other places. So once it hits around the world, and I'm glad you guys are talking about it, and I'm glad Lindsay Lohan put it on Instagram, because now the world will know about chick V and the fact that it can be disabling. To answer your question about can it move around, yes. You know, what's happening is that once the virus is there, your immune system has to deal with it, meaning that it has to attack it. And when the immune system attacks it, it can often give you problems with your own body. So the joint pains and some of the problems you're talking about deal with your reaction to the virus, and it sticks around. But it will, over time, it should go away. And if you try to use the medicines we talk about, and make sure you see a doctor if it continues, and make sure that we're on the right path. But absolutely, it can happen. people, it can happen up to 3 years afterwards. It's been shown in studies. In some places, about 60% of people 3 years out have some form of arthritis or arthralgias. Not disabling like it is in the first couple of months, but it can last for a long time. So definitely.
All right, Clive.
Thanks,
Well,
Clive.
one last question.
Sure.
Yes, sir.
With the virus still in your body, if you get sick with some other form of disease, is it likely to kill you just the same?
Well, no. The idea is that if you have another disease that's there, so you're not as strong to fight this, then you are more prone to get other complications. But if you get another disease while you're having it, I don't think you're more prone to have more serious effects with it. I think if you already have a disease that brings your immune system down and brings your general health down, then when you get hit with the CVM, then it can make you more susceptible to have other complications.
Okay,
All right.
thank you. Thank you very much.
Thanks for the call, Clive.
Thank you.
All right, so this is where we're going to have to leave that topic, this discussion this morning. We're going to hear all about a partnership for the health between the NHF and the Ministry of Health when we return. Minister Ferguson is here. It should be interesting, so stick around. We'll be right back.
One Panadol, quick boom. Me if you wanna if a epidemic, you know in a public